we are recording. Hello, Dr. Pete. How are you?
Oh, I'm good, Michael. How are you?
I'm doing very, very well. And thank you for being on the show today. This is going to be a fantastic show. We're going to be talking about something really different and fascinating. And I have to thank Dr. Jennifer for connecting us because this is a fascinating topic. I had no idea this even existed. But when I was doing my research on German New Medicine, I was like, this makes sense. Like, why isn't this being taught? Like, this really makes sense. Like, I'm thinking, okay, I need to find somebody who can really talk about German New Medicine and what it's all about. So, that being said, Dr. Pete, what is German New Medicine?
Well, you've probably heard of many different types of mind-body sort of systems. This is sort of similar. The difference here is some of the other systems tend to be a bit more on the intuitive side, on the energetic side. And while this probably does incorporate that as well, this system was developed in a very scientific way. So maybe I'll just kind of go back to how it started.
Yeah, please.
Yeah, so Dr. Hammer, who discovered German New Medicine, lived in Germany, and he worked in a cancer clinic actually himself. And his son was in Italy. He was on a yacht, and he got hit by a stray bullet, and he was in life-threatening condition. Dr. Hammer gets a phone call, says your son's in intensive care. Come to Italy. So Dr. Hammer goes there, and you can imagine what he might have experienced when he received that phone call.
Sure.
His body and his mind and his emotional state. Probably it was a shock for him. So he goes, he's with his son. His son lives for another 6 months and then dies in his arms. And then Dr. Hammer, 6 months later, develops testicular cancer. And it was a mystery because Dr. Hammer was healthy his whole life and he worked with cancer patients and knew what to do to stay healthy and avoid this sort of situation. So he, being a scientist and having a curious mind, he went out to discover how sometimes after we have unexpected shocks, we can develop illness in our body. In his case, it was cancer, but he actually went on to, in his system, he figured out all different types of symptoms and diseases and what sorts of scenarios may happen before that may lead to those outcomes later on. And so he's working in a cancer clinic with hundreds of cancer patients in this place. So he's walking around, he's asking questions. He said, what happened to you before you got sick? What happened to you before you got sick? And he found there was a pattern. People were sharing a similar story where they had some sort of shock before they got sick. So he's like, okay, maybe I'm onto something here. But why would one person have a shock and have one sort of illness or disease and another person has a different one? Say in one person their pancreas is affected, another person their liver or their testicles or their breasts. Why is the body playing these things out in a different way? So then he thought, how can I explain this? What is the master control center of the body? And it's the brain. The brain controls so much. So what he did was, he's like, what if I take CAT scans of people's brains after they've had shocks and they developed illnesses to see what happens in the brain that might not have been looked at in any other system? And what he found was, if you, there's some sort of, let's call them ring structures in the brain that can be found in CAT scans that occur after these shocks happen. And depending on which region of the brain these rings occur in, it correlates with which organ of the body ends up being affected later on. And it could be something as simple as having a skin rash because you've experienced a separation conflict that caught you off guard and it affected a certain part of the brain and ultimately an organ of the body, the skin. And I'm sure we'll get into more of the details of how this plays out. At some point in the future, the person who experienced that shock related to a separation conflict has a skin issue.
Okay.
Yeah, so in these multiple decades that Dr. Hammer was studying this, he did over 50,000 CAT scans of people's brains, and he sort of mapped out almost every, as far as I know, so many parts of the body have been mapped out. He's mapped out what the conflict is. I'll call it an emotional conflict, but really it's not the best words to use, but it's kind of a good way to kind of start to understand.
Yeah.
Think about the phone call that Dr. Hammer received. In that moment, the conflict that he experienced, which we know because he developed an issue with his testicles, is a profound loss conflict.
Okay.
Okay, so the idea is that, in his case, he developed testicular cancer. If you were to speak to others who have testicular cancer, there may be a similar pattern where they experience a profound loss that caught them off guard at some point. The phone call was the threat of a profound loss. Your son is dying, he's been shot. So, in that split second, what happens is your psyche labels or kind of like assesses what this information means that's catching you off guard. And for him, it was a profound loss conflict. For someone else, it might have been a separation conflict. And then ultimately, when the body relaxes about the situation, when there's a resolution, the skin would have been affected if it was a separation conflict.
Okay. So basically, what it comes down to is that you have these initial shocks, or like conflict shocks, or basically traumas, is
Yeah.
what they're really what it kind of refers to. So you have an event that in your life, again, whether it's like a loss of a family member, a loss of a job, an unexpected and uncontrollable separation or loss or something. So some traumatic event that has happened to you that triggers this response in the body. Is that how it really is
Yes.
in some ways?
So it's a traumatic event. Just to be clear, though, it's not the event itself that needs to be traumatic. It could be something as simple as, um, you're expecting something to come in the mail. Someone promised it to come in the mail, and then it didn't come in the mail. And for some reason, there's something meaningful about that for you. So, you know, you and I may say, what's the big deal? Just get it next week. But for that person, if that shock, unexpected shock, has a certain intensity to it for them for whatever reason, that may also cause a conflict. So, and on the conversely, on the other side, you and I may be on the sidewalk having a conversation, and right in front of us on the road, there's a car accident. And let's say it's just a small fender bender. For you, that's not intense enough to cause a conflict shock. But for me, I may have a major conflict shock. And part of the filters through which we see our world also determine how intense our shocks are and what we might have a shock about.
Okay. So again, it doesn't have to be so traumatic as it's a, so even just the fact of witnessing something may trigger that response, or being associated to that specific thing that may not. Again, the understanding of our own filters. So let's say I had a messed up childhood, and I got all these crazy filters, and again, how I see life and how I respond to life is going to affect me a lot different from some, let's say, yourself or anybody else that goes through life right now. And so, like you're saying, if for say I had the separation loss, and then I lose something that could cause, now is it a consistent, a repetitive type of action that causes the overall inducement of this, or is it just one episode that could trigger it? Or so it's like I have loss after loss after loss after loss, or is it just one specific larger loss that actually triggers the event? I'm just trying to figure if it's cumulative, or is just one particular one that actually triggers it.
Well, the key is that it has to catch you off guard. So that's one thing.
Okay.
Okay. So let's say, for example, you're working somewhere and your company is downsizing. Okay. And you've worked at this company for 30 years. And a year ago, there was an announcement made that there's going to be job cuts. And let's say in the first month, one of your colleagues got let go. In month 3, another colleague got let go. In month 6, another colleague got let go. And this is a team of 20 people. And after a year, there's 5 people left, and you're one of the 5 people. Now, that would be a lot different scenario than the announcement is the department's cut. Everyone loses their job immediately. So, and the other thing too is, in this example, if I knew that my company is not profitable, and I'm thinking to myself, it's only a matter of time before they cut our department, the chances are that there's a part of me that won't be caught off guard if I get that information, that news.
Yeah, I guess that's a big difference. That's a really big difference because you're almost anticipating what's going on because you know that this is a possibility that this may happen. So you can better prepare for it versus just walking in one day and here's your papers, thanks very much, and walking out the door.
Right. It's not a
And
sudden shock.
yeah, I've had that. Actually, it's interesting. Before COVID, I actually had that experience
Mm.
where it was pretty profound. Yeah, I understand like the whole lost conflict idea, and it was pretty traumatic. And it's interesting in myself when I was listening to this, and I'm going, geez, I've had a lot of conflict shocks in my life. And just a couple recently too, as well. I mean, at the same time, when I had that job loss, I lost my stepbrother a couple weeks afterwards. So I had like a double dose of that, which was unexpected. He took his own life, and it was like pretty. It hit me really hard. Like I mean, the job loss, obviously, I've had that before, so it wasn't like it was a new experience, but it was something that I thought, oh my god, I can't believe it's happening. And then the shock of losing my stepbrother, that was, and then it kind of accumulated. Then it's like, holy crap, man, that was interesting how those correlated together. And by reading this, I was like, Jesus, I hope I don't get cancer because of this. And I mean, there is a history of it, but I mean, I do take care of myself and I make sure that everything is on. But I really want to talk to you about the areas of the brain. I don't know if you can touch on it too as well, because, or maybe even touch on the different types of conflict that is associated with certain cancers. Like, let's say, like you're talking about the testicular cancer with the loss. Now, what happens with breast cancer, lung cancer, kidney cancer? Maybe you can just touch on that a bit.
It brings in a bit more complexity now if we're kind of getting to the more of the specifics. So one of the things that also comes into play is your handedness. Okay. So in German New Medicine, the side of your body that's affected is also important. So when you clap, if you clap with your right hand over your left hand, if that feels more natural, then you kind of follow the typical pattern where the left side is about um, mother child, and then the right side is about partner.
Okay.
Okay? Uh, or if you clap with left over right, then it's the opposite. Okay.
Okay.
Okay. So yeah, so usually clap test is important because sometimes the side of the body that's affected is important. It has a different conflict associated with it.
Okay. So it's almost like, the male, female sides of the brain or how they're thinking, like one is the more feminine energy. And again, this is from my energy background, is basically they're separating in two types of energies. When we deal with this, the left side is the female side, which is about, giving, and the other one is about receiving. So there's always that balance of two. So one is more male dominated, one is more female. So whatever's figuring on this side is usually associated to like a mother, like you're saying, like a mother syndrome or a mother child type injury. And then this is a masculine, so like a father type injury too as well. It
The
sounds similar to that.
Similar to that in the sense on the mother side, mother child side, on the left side. On the right side is about partner. So partner can mean relationship partner. It could be business partner, and technically it kind of covers everyone that's not on mother child. Everyone else is kind of like someone you have a relationship or your partners with.
Okay.
Okay.
Yep.
Okay.
Yeah.
So
So I mean, it's really. I when I was researching this, and I was like, man, this really makes a lot of sense. But there's also a lot of controversy around his information. It seems like there was he got a lot of blowback from it.
he did. Yeah, he was taken to court many times. His license was taken away. It's a very controversial system that he's proposing, that he developed, especially because part of the system speaks to speaks around cancer, and anytime you're speaking about the topic of cancer, it can be very charged. It can be a very charged topic.
Yes, that's for sure.
Yeah, and his system, the beauty of his system is that it doesn't only speak about cancer. And with myself, I don't. If I'm using this system with patients, I'm not necessarily using it as a treatment for cancer because that's outside of the scope of my practice. I'll leave that for those, they're oncologists and the other professionals that are, helping them with treating the cancer. But sometimes speaking about life's events, and understanding how life's events can affect our body can also be beneficial. And the system is beautiful because because there's laws, and because it's reproducible, and because it's kind of covers the whole body. It could be, uh, for example, if you one topic that I've spoken a lot with my patients is ovarian cysts. So ovarian cysts, according to German New Medicine, is about losing a loved one.
Okay.
Or it could also come into play with sexual conflicts that may happen with your sexual partner. So timing is key with German New Medicine. So when a symptom begins, there's usually a correlation with something that's happened in life. So for example, if a female would come in and might have a cyst, I might say, oh, what was going on around that time? And because I know that the theme of either loss of a loved one or a sexual conflict with a partner may be in play, if she says I ended a relationship at that point, then it's like, okay, this might line up. So then we kind of explore things a bit more. And the other thing with German New Medicine, the second biological law, is that following this conflict shock, so initially you get this information, your psyche interprets it in that split second. We'll say when Dr. Hammer got his phone call, something happened in his brain, something happened in the organ of the body, and now a chain of events is unfolding. And the second so that was the first biological law. The second biological law is that all diseases follow a two-phase pattern. So meaning that initially after the shock, you go into a conflict active phase. And then once the conflict is resolved, if it is, because we don't resolve all our conflicts, if it's resolved, then you go into the healing phase. And the thing that's a bit backwards with German New Medicine compared to Western medicine is that the symptoms or the pathology often appears in the healing phase, not the conflict phase.
Interesting. That's
Yeah,
really interesting, because you would almost think it was like, well, that doesn't make sense.
it doesn't make, you would think it doesn't make sense. But what tends to happen is once you go into conflict, your sympathetic nervous system, the fight or flight, and the stress response in your body amplifies. It like really ramps itself up, because it's almost like your body is mobilizing its resources to metaphorically use the body as a way to solve the thing that catches you off guard. So I'll give you an example. This one is really easy to follow.
Okay.
So with the digestive system, the conflict associated, the general conflict, there's more specific ones, but the general one is an indigestible morsel conflict, meaning you've received some information, you've learned about something that you just can't digest. How could this be possible? An example might be you come home from work and you find your partner is in bed with someone else, and you had a good relationship, and you can't compute, how is this happening? So you go into conflict, and in this type of conflict, an indigestible morsel, your body is trying to digest information which it can't compute. So how does the body digest things? Using the digestive system.
That makes sense.
So what does it do? Your body starts to increase the production of acid secreting cells in your stomach, because it's trying to increase the capacity for digesting morsels. As animals, the morsels we digest are food and things that we eat. But metaphorically, the body's trying to amp up its ability to digest this information. So that's what it's doing. It's building up the digestive system. And then when you say you have a resolution to this conflict, then the body is going to break down everything it just brought, all the resources just brought into your stomach to digest this information, because it doesn't need to digest anything anymore. The situation is over. And oftentimes that's when you get your heartburn and you get all your symptoms as things are kind of breaking down, let's say.
Wow. I mean, that makes total sense. It's just the body's trying to prepare itself for an initial, the trauma, but also trying to prepare itself just in case it happens again. And it seems like it's kind of this repetitive system, this thinking and feeling system that keeps triggering the response. So you touched on the first and two biological laws. There's five in total, isn't that correct?
There's five, yeah.
Okay, so let's go on to what's the third one?
So the third one is that the part of so it brings in embryology. So there's three layers of in embryological development related to the organs and different cells, types of cells, and depending on which layer of embryological development is related to the organ, the part of the body that's affected kind of ties into which part of the brain is going to be affected.
Okay.
Yeah.
So even so he's actually gone back to in the actual state where it's an embryo or it's a fetus, and he's figured that out, that at that particular stage that could be that this could be a trigger.
So um, I can't speak exactly to I can't speak in detail to exactly what Dr. Hammer's work was around where he went in terms of studying embryology. What I do know is that we know that certain certain tissues of the body begin to multiply in the embryological stage in a certain layer of the embryological tissue. So that's kind of the connection. So if there will be there will be similar conflicts in different parts of the body if those tissues in those parts of the body were developing in that layer of embryological development. So you may find similarities in different parts of the body. You may find separation conflicts in different parts of the body, not just on the skin.
Okay. So how is, like, what happens if during the development stage of the fetus, the the mother actually has a conflict shock? Now,
Yeah.
is that going to be actually affected? Well, as far as I know, I understanding that that will make plays a dramatic effect on the overall development of the fetus too, as well.
Yeah, it's very possible that during time in the womb, if mom experienced the conflict shock, that the fetus can also be affected by that.
Yeah. So again, as it's developing now, well, the fetus, I guess, obviously, if it's the same conflict, will the fetus have a more potential to have a conflict shock similar to the mother's? So if she had a traumatic loss or something like that, and again, her psychic, her brain, so it's sending the messages through her body to a specific organ that's going to cause something to happen. But also during that, it's also triggering the fetus too to develop that particular part of that brain to actually activate that any conflict shock that they may have in the future?
Okay, I just want to clarify a few points. Just I want
Yeah, I mean, I'm a little over the place, but yeah, yeah,
to.
bring me in here.
Okay, so in the moment when a conflict shock happens, and remember, a
Okay,
conflict shock means that something's happened that catches you off guard. It has some importance to you. It can't just be a conflict shock about something that is not irrelevant. Then you're not going to go through a conflict shock because it's not meaningful.
okay,
Okay, so if something catches you off guard, in that split second, your psyche, your brain, and your organ are affected in the split second. Okay,
okay,
and if we had a way of watching your brain and the organ involved and watching it, moment by moment, we would see changes would be continuously happening from the moment of the shock to the time of resolution. Okay.
okay,
So your question about mom and the fetus. So suppose while mom is pregnant, the father of the child leaves and it catches her off guard. And she has a separation conflict. But it's not necessarily true that because the father has left, that her conflict will be a separation conflict. It could also be an abandonment conflict. So if it's a separation conflict, ultimately she'll have a skin issue. If it's an abandonment conflict, she may have water retention or issues with her kidneys. Kidney function will change and water regulation will change. It could be maybe it's some other type of conflict. Let's leave it at those two in this example.
okay.
Okay.
All right. So then we're on to number three. So number four. So what's the number four law, biological
Yeah,
law?
so number four is that microbes in the body are actually there to optimize healing. When we have a sore throat, one of the things that we do is we swab the throat to check for strep bacteria. And, we have to take this seriously because we don't want things to escalate if that's present. So, although I may speak about German new medicine, I'm also aware that there's risks of, simply using German new medicine, not thinking about other things. But let's just talk about the conflict side of it. There's a high uh, population of strep bacteria, and the conclusion is this strep bacteria has caused this sore throat. And we need to eradicate this strep bacteria because it's the cause of this disease. Now, what German new medicine says is the strep throat did not cause the disease. There was a conflict that was playing out, and the person um, went through the conflict active phase, and in the healing phase, the strep bacteria actually came to the throat and multiplied because microbes optimize healing. So it has a function to play in restoring those tissues of the body back to their state before the conflict happened.
Controversy comes from is because that could be like, wait a minute, are you saying that, okay, the strep is not caused by the bacteria, but it's actually just present because of the conflict? So it's not actually saying that the microbes or anything else is causing the disease. They're there for a specific reason, but it's not that the actual cause of the disease. Is that correct?
That's correct.
Okay,
And
so that would be very controversial because I think most doctors would be kind of, I think that seems like a load of crap. What's up with that?
exactly, yeah, it is very controversial. Yeah, and even with myself, if I see that someone has, a really, certain presentation with a sore throat, I will refer them to their medical doctor to discuss antibiotics or whatever needs to happen. Um, you know, Also kind of keeping this in mind that this might also be playing out. So, in what I do, it's a bit of a balance in making sure the patients are safe and also kind of giving them some insights about what might be playing out.
So yeah, there's always been that mind body correlation to everything. I've always believed in that. A lot of the people I follow, and I just think that it is such a huge part of in disease and healing and everything like that. So okay, we got number 4.
Yep.
Let's go to number 5. So what's the last biological law?
Yeah. So the last biological law is that everything that plays out in your body has a meaningful purpose. Okay. That
Okay.
we're part of nature and that there's programs and there's intelligence built into us so that all these programs that we go through, these symptoms and diseases that we go through, uh, there's a purpose for them. So, having said that, it doesn't mean that we never intervene. We don't just like leave everything and just allow things to completely unfold all the time. So, but that's the fifth biological law. Yeah.
Okay. So what is the treatment protocol then? Okay, so it seems like, okay, it's another way of diagnosing the underlying problem of what's happening within the body. But how do you, okay, let's say for example, okay, let's go on strep throat. Let's go on strep. So you talked about obviously the antibiotics, stuff like that. So again, how do you figure out the protocol for healing? Is it basically just saying, okay, this is the diagnosis, and then we use traditional types of healing modalities to work on that? Like, how do you figure, like I say, you have the conflict shocked. So it's a obviously it's a psychological problem in some ways. So there's that it happens in the brain. Okay, just feel me out here for a second.
Okay. Sure. Yeah. Yeah.
Yeah, feel me out here for a second.
Yeah. Yeah.
I'm
Go.
I'm trying to correlate my thoughts and I'm trying to figure out if it's in the brain, if it's in a reaction. So how do you treat that? How do you resolve the conflict? I guess that's the best way to go. How do you resolve the conflict?
Yeah. So it's a biological thing as opposed to a psychological thing.
Okay.
Biological because it's the biology that's playing out the shock. It's not like you can't think your way out of going through a conflict. If something catches you off guard, the conflict will happen. It's a biological law if you believe this system. Let's use a simpler example because when you're talking about strep throat, there's a bit more urgency and there's more, let's say, risk of using this system. because if you wait too long, there could be consequences. So
Oh,
let's
of
talk
course.
about skin.
Okay.
So let's say you get a rash, you've been dealing with it for a long time, you've been dealing with it for 6 months. You've tried some creams, maybe it helps a little bit, maybe at the beginning it helped, but now it doesn't help. And you're kind of just like, I don't get why it's doing this. I've changed my detergents, I've changed this, I've changed my clothes, I'm using cotton instead of whatever. Um, okay, so then it's like, what was going on 6 months ago? Okay, so I know it's a separation conflict, and let's say it's a male, and the male is right-handed clapping, and that the separation conflict is on the right forearm. It's like, okay, so I know it's a separation conflict related to the partner. So just by seeing their symptom and I know how they clap, I have an idea of what might be playing out for this person. So then, and it reproduces itself, which is why I have confidence in this system. So I'll say, what was going on 6 months ago? And the person says, I ended my relationship.
Okay.
Okay. And it consistently happens where, you know, ended the relationship. Okay. And how did you feel about that? And it could either be, so sometimes what happens is, if it's on the inside of the arm, it's that you're separated from someone that you wanted to continue to hold close to you. So it's almost like the separation is undesired.
Okay.
Okay. If it's on the outside of your arm, you can also have a separation conflict. The outside of the arm means you finally separated from someone you've wanted to push away for a long time.
Okay. That
Okay?
makes sense. Yep.
Yeah. And when you get the symptoms on your arm will depend on how strong the intensity of the original conflict would have been. So in order to use this system, you always have to remember, you have to go back, and there has to have been something that caught you off guard. Okay,
Okay.
because there are other scenarios where you can't use this system. Okay, so I could also have a skin rash because I've just drank something that's toxic. And the skin is one of the organs of detoxification. So if I get a rash after I have something that's toxic, that's not a German new medicine conflict. It's a toxicity issue.
Okay.
Okay. I can also have a skin issue if I have malnutrition. So if I'm not eating enough fats or I'm not eating enough protein, my skin is going to be affected because you need fats and protein to have healthy skin. Okay. And then the
Yep.
third one is physical trauma. So if I bang my arm against something and then something's going on with my skin, well, it's a physical trauma,
It's a physical trauma.
right?
So it's almost like it's like another tool that you can put in the toolbox to diagnose something, right? So you can always kind of look at it. It's like, okay, so you're Mr. Dress Up and you can pull out the chickle trunk and you can go in there and start look around and kind of go, let's pull this one out, let's pull this one out. So it just gives you another tool to utilize to figure out what's happening within the body and what's happening with your patient.
Exactly. And to help them bring understanding and to have confidence and decrease fear about their health because they know, oh, that makes sense. I separated from my partner who I didn't want to separate from. It caught me off guard because they broke up with me out of nowhere. And, say it's a male, right-handed clapping male, it makes sense that the rash would be on his right forearm. And here's the crazy part. Oftentimes, after they make that connection, so they've already tried all the medications, they've already tried a whole bunch of other things. They have that conversation. It's almost like now their psyche has been seen, has been heard, the connections are made, the message that the body's trying to communicate has been heard, and then within a couple of days, it gets a lot better.
Yeah, there's no medication at all. I mean, that's the power of the mind. Like that's just
Yeah.
the body. Yeah, it's amazing how it always fascinated me how the body mind really works and how it quickly can heal itself. It's unlimited what we can do, and if we just get out of our way and it's just those small little incidences where that illumination from that's like, oh my god, that makes total sense. And it's
Yeah,
like, huh, I've been feeling this, but on a subconscious level, he didn't know what was going on, but the body
exactly.
knew what was going on, but he didn't really know what was going on.
Yeah, exactly. And for myself, the perfect example that I have of this in another realm is I've done therapy in the past, and in therapy you share different experiences, and your therapist might say, "Oh, that's interesting. What you're sharing right now reminds me of this other situation, this other situation. Is it possible that this is playing out for you? This pattern is playing out for you?" And they name a pattern, let's say. And then it's like, oh, I never thought about it like that before.
Yeah.
And once that clicks, you can't look at those situations the same anymore. It's like kind of like what you're saying, something that was subconscious now has become conscious.
Yeah, it's really profound. I mean, it's funny because I've had that same experience in therapy myself, and it's like, yeah, they'll just point it out. You realize you're not like that same person. You realize that, and it's like, what? And you just pause for a second, and it's like this big light bulb just turns on.
Exactly. Exactly.
Yeah,
Yeah.
it's so profound. I mean, that was like the one of the great things I loved about therapy is because of those moments where it's like, you keep repeating these patterns, you're not sure what's going on, and then all of a sudden they kind of just bring you right back and say, "Hey, by the way," and
Exactly.
then yeah, the light bulb goes off. So, well, it's really interesting. I mean, it's another great tool. I mean, to have in your toolbox to look at a new perspective, how to help diagnose, certain symptoms and diseases and things like that too. But I wanted to touch on something too as well that seems to be kind of like a dying art right now is homeopathy. And I've
Mm.
had a lot of had a couple of naturopathic students I've talked to over the course of the of my podcast, and they're saying how it's starting to be phased out in this naturopathic college. It's just basically being phased out
Yeah.
for more contemporary, I will say, views on medicine. And I actually love homeopathy. I didn't at first when I heard about homeopathy, I just thought, yeah, this is a load of crap. The
Yeah.
vibrational patterns of this little thing is going to fix me. Yeah, come
Yeah.
on, give me a break. Like really?
Yeah.
And once you start using homeopathy, and again, for the most part, I started using like the basic, like rescue remedy. That was the kind of like the first kind of thing. And it's like, yeah, this stuff's not working. But then it's like, because it's so subtle, it's not as dramatic as like, say, if you take a pill, like a pharmaceutical pill, and it's like, bang, okay. But it's just that subtlety, but you just don't have the after effects. And then I use Arnica all the time.
Yeah.
I found that's like my go-to thing because I was traveling so much. And a friend of mine suggested, once you start taking Arnica when you travel and your rescue remedy, because I'd have like major jet lag, just feeling like crap. And then coming back, the time zones, my body
Yeah.
was just a mess. But that stuff, I swear by it.
Oh
I
wow.
swear by it. Yeah, I absolutely love it.
Cool.
Yeah.
Yeah. I've never tried it myself for jet lag. I've heard that it can be helpful. So yeah, that's cool to hear that it's helped you.
Oh yeah. It was like my go-to bag. So it was like I had the rescue remedy and I had the Arnica and I had the rescue remedy in lozenges too as well. And of course, I'd have like Advil just in case, but that's like my little go-to little
Yeah.
stash that I have when I'm traveling. I was going back and forth to the UK a lot, so I was flying over overnight and then working the same day, and it was just like and then working long hours and coming back. So my body was a complete mess.
Yeah.
But yeah, I find that I don't know a lot about it because it's so many different variants of homeopathy. Like you look down the list if you go to any health food store, and there's like 50 different types of homeopathy treatments that you can use for that. So, do you still use a lot of homeopathy in your treatments for your patients?
I do. Yeah, I do.
Yeah.
So yeah, we spoke about German new medicine. It's quite a unique system, and not everyone is into it. So that I don't use that with everyone. And homeopathy, I definitely use with most of my patients. I actually, before I learned of naturopathic medicine, I didn't know anything about homeopathy. It's not like I grew up and kind of was exposed to these things all my life. It was kind of in my late 20s, I think, when I first learned about homeopathy. I showed up at the naturopathic college, and at that point, actually, I was very much into bodybuilding, and I wanted to become a vegetarian bodybuilder. Okay.
Okay.
So I show up, there's a student clinic at the college. I show up, I'm like, okay, I'm here to become a vegetarian bodybuilder. Help me with my diet. And I had like all these charts, and I had like, I was weighing my food and measuring everything. And they're looking at me, they're smiling, and they're like, okay, we've got a project here. So they're asking me all these questions about how I feel. And, I'm like, I didn't think that this is what I was here for, but it was actually, it seemed appropriate for the conversation. And then at the end of the conversation, they sent me home with a diet diary. So they still kind of, went along with what I was asking for. But they also said, okay, get this Bach flower remedy, get this homeopathic remedy, and we'll see you next time. And that's how it began. I started to realize more about my emotional health and how different experiences in the past have shaped who I was and how I am in the world. And I kind of went away, slowly have drifted away from that bodybuilder mindset. And a lot of the work I do with my patients is mental, emotional support. And
Okay.
homeopathy is great for that, because the cool thing about homeopathy is, although you're taking a medicine, you're taking a physical medicine, in a pellet form or in a drop form, it actually it affects everything. The principle of homeopathy is that, well, it's like cures like is the main principle. Okay, so the simplest example is, if you have if your nose is like really runny, you've got watery eyes, maybe your eyes are burning, kind of like the symptoms you would get if you're cutting an onion. Okay,
Okay.
right? Those just most people can imagine that. In homeopathy, what you could take is a remedy made from an onion, because an onion in its crude form produces those symptoms. But when you take that onion and you create the medicine from it, so there's a certain way of, diluting it with sugar and blending it and shaking it and mixing it and all kinds of stuff, diluting it. By the time the medicine is made, the onion, which in its like raw form causes those symptoms, in its homeopathic form helps those symptoms. And the way it works is, when you take the medicine, you're introducing a vibration, a frequency into your body that kind of gives information to your body about something that's out of balance, which maybe it wasn't picking up on. So it's giving the body a stronger signal about something that it needs to regulate better. And in temporarily introducing that frequency, the body's like, oh wow, nose is running too much, eyes are burning too much. Let's go back into homeostasis. The body's always trying to regulate us into balance, and it has the opposite effect. So it actually has a drying effect on the nose, on the mucus of the nose, as opposed to real like actual onions make your nose run.
Yeah, it's so fascinating. I mean, it's like the vibrational information that kind of like tricks the brain and the body to kind of go, oh, by the way, you know what? Let's just use that. And
Yeah,
I like like I said, like years ago, if you were to talk to me about homeopathy, I would have told you were crazy. That stuff's just like it's hogwash. But as I learn and as I grow and develop, the idea, of vibrational medicine is such a huge thing. I really think, vibration medicine in the future is going to be the key thing in medicine in general.
I agree.
I really think that not just in the subtle way like homeopathy, but just in general, vibrational medicine is going to be like the new thing. Well, it's going to be the old new thing. So, they were using that back in the Egyptian times, but it'd be interesting to see what happens. So, are there particular I know I use Arnica. I've used the Bach flower remedies, rescue remedy. Is there something in general that if people are looking at interested in trying out homeopathy, is there certain recommendations that you could would think of?
I can't really suggest for people to take things, but I will say Arnica is kind of probably the most prescribed homeopathic remedy.
Okay, so let's talk about Arnica. Let's talk about what it does and
Yeah.
what is it good for? That's not a bad idea. Let me have a pepper to myself
Okay.
here.
Yeah. Yeah. So on a physical level, Arnica is great for shocks, physical traumas, bruises. Okay. So, say, if I was in a car accident, I'd want to take Arnica right after, because it's sort of an anti-inflammatory. It helps regulate the inflammatory response so it doesn't, get out of control.
Would
It
that
doesn't,
be good for any like digestive issues and stuff like that, or GI inflammation?
well, see, with homeopathy, the accuracy of the treatment is really based on individual experiences. Say, for example, you're talking about GI symptoms. So if I was working with somebody with GI symptoms, I would ask all kinds of questions, like exactly where they feel the pains, when does it happen, how long does it last, what makes it better, what makes it worse. So that's one of the interesting things about homeopathy that allows it to be such an individualized medicine, is that somebody can come in with the same concern, like GI issues. Say if I have 10 patients with GI issues, and they may even have some similarities to some of their symptoms, but there's something subtle that's different between each person. So let's say one person is quite excitable and energetic and like high energy, sparky, let's say, versus someone else who's a bit more, grounded, quiet, timid. Even though they have the same medical pathology, let's say, the homeopathic remedy that they get may be different because the homeopathic remedy, the way that I use it to treat the whole person. And
Okay.
also accounting for that piece of the puzzle that, the GI issues. I look at that and I'm like, how can I understand why this person is experiencing this in the context of the whole picture of the person?
Okay.
Now, if we go back to Arnica, Arnica is
Yes.
an interesting one. So Arnica is a part of a plant family called the Compositae family, so the daisy family. And, there's a mental emotional picture of Arnica as well. So they're very sensitive, they can be easily hurt. And one of the keys to know that if Arnica is useful, might be useful for you after a car accident, let's say, is people who benefit from Arnica, they may have severe injuries and they may walk away. You may say, "Oh, are you okay? Are you okay?" And they're like, "Oh, I'm fine." And meanwhile, you look at them and it's like, "We need to go to the hospital right now."
Okay.
Right? So that they deny their injuries.
Okay. That
That's,
makes that makes sense. Yeah. I mean, I swear by that stuff. Like, I mean,
yeah,
it's helped me out so much. Now, what about okay? So Rescue Remedy, it's a blend of stuff, right? Is that correct on that? And
that's
again,
right.
I'm not sponsored by Rescue Remedy. I'm using it. So, but if they wanted to, just to let you know, I mean, but anyway,
Yeah.
so let's talk about that. Yeah, go ahead.
Yeah, that's a powerful one. That one's really powerful, popular all around the world. So Edward Bach, the person who developed the Bach flower remedies, is from the UK. So what he realized was um, every plant has a different emotional vibration, a different emotional frequency. And if you look at the range of emotions, the polarities of similar emotions, like let's say, for example, um, if you're looking at love and you look at the opposite end of that, could be hate, could be despair, or if you're looking at, say, hopefulness, and the opposite end of that is despair. The idea with the Bach flower remedies is that if someone is experiencing, say, something on the more negative side of the spectrum of a similar emotional range, that by taking the Bach flower remedy, you're introducing that, the vibration of the opposite, the polarity of what you're experiencing. Say, for example, if you're feeling hopeless and you take a Bach flower remedy that helps to cultivate hope, the idea is that they can't both exist simultaneously. And by taking the Bach flower that has the vibration of hope, and you consistently take it, it's almost like a tuning fork of that emotional vibration for your system. And over time, you become attuned to the vibration of hope, and the hopelessness can, begin to fade because they can't both exist simultaneously. You can't be hopeful and hopeless at the same time.
Yeah, they just cancel each other out. It doesn't make sense. But
Yeah,
that's a really interesting thought. So, I mean, if you're consistently taking that, you're just physically tuning your body into that vibration. So, in essence, you may be able to track more hope and have those feelings of hope, or even like love. And so, if you're having a Bach flower remedy that's associated with love, and
yeah,
changing that association with love, you'll probably admit more love in some ways. Would that be? Yeah.
yeah, yeah,
Yeah. Okay. Yeah. Yeah. It's fascinating stuff. I think it's it's sad to hear that it's being phased out. Um, and I don't understand why. I mean, the whole idea with naturopathic doctors isn't natural. Is the whole thing with natural? And I just
exactly.
see that trend where it's just the ND is just going to be just another form of MD.
Yeah, well, you bring up an important point that we have to consider, that in my profession we have to consider, and, in general, patients, a lot of patients come to us because they want to have those traditional methods incorporated in their treatment plans. And, if the gap between, or if the difference between a naturopathic doctor or maybe and some form of maybe more conventional doctor closes, then that'll be something to consider about how we handle that. Naturopathic medicine did begin. One of the main principles of naturopathic medicine is utilizing the power of nature. Being honoring the intelligence of the body, getting to the root cause of disease. So we really, in my profession, it's very important that we remember this, and as we're choosing how we're helping our patients, that that we're honoring these principles. And I think having a combination of some part of my practice that's more Western geared in terms of like doing labs and testing, and say referring to doctors for medications in some cases, and also Chinese medicine, botanical medicine, homeopathy, like having all these things together, all these different ways of supporting is so important.
Yeah, it's so true. I know I had a conversation with Dr. Jennifer,
Mhm.
and she was saying in a really uh, utopic type world
Mm.
that the naturopathic doctor would be the main doctor. And if you had something that's serious, like you broke your arm or you had this or you had that, that's when you would go and to the regular doctor. So unless it was life threatening and serious, because
Yeah,
allopathic medicine is great for those things. I mean,
of
if you got to
course.
do a heart surgery, you, I mean, you want to go over to a heart surgeon, get that heart surgery taken care of, right? So if you have a blockage in an artery and all that stuff, I mean, that's fantastic. But for the most part, just general overall health. And then if you maintain the health and again, it's more preventative medicine versus reactive medicine. And,
Exactly.
and if we kind of move towards more proactive versus reactive, it'd be such a good place. And I know she talked about that too as well. And, we talked about also too, is that, as Canadians, we don't really have to pay for medicine in general. So we've been very, very, very blessed today. And we also talked about how we're very spoiled in that same way.
Mm.
And if we had to start paying for medical treatments, I think most people would start working on the preventative medicine a little bit more than the reactive medicine.
Exactly. And you know, I think what should happen is when you go and you see your medical doctor, you go to the hospital, even though we're not paying out of pocket, I believe that everyone should have a notice of the cost of their treatment, of what the government has paid for that treatment, just so we're aware, right? Because we don't know now. We don't know that having that emergency room visit costs $2,000 or whatever, and it may get people thinking more about preventative medicine.
Yeah, I think that would really be an eye opener because again, we just take advantage of it. I mean, I'm sure glad it's there to be honest with you. I mean, I'm not knocking it. I mean, I've made full use of that. But it does really make you aware. Like, you hear those horror stories in the States where, if somebody's got an injury or something like that and they're hospitalized and their insurance didn't have insurance or the insurance company didn't cover it, and they got like a $500,000 bill from the hospital for a week. And it's like, okay, they're now got a third mortgage, fourth mortgage, whatever, and or maybe they have to go bankrupt because they just can't afford it. It's just it's sad to see that in some ways, but hopefully we don't get that far here in Canada. And I am grateful for our system. It always could use tweaks and improvements in our system itself like that. It's not 100% amazing yet, but it's pretty damn close in some ways. So, but I also appreciate what you guys do as well as naturopathic doctors. You guys are always in the front line, and you guys take a lot of crap. I know you got a lot of heat going on, especially nowadays. You guys got a lot of heat coming down too as well, and I appreciate a lot of you doctors out there sticking your necks out there and informing us and keeping us healthy and giving us new ideas and thinking about new ideas like this German new medicine and something that's available to us too as well. So that being said, Dr. Pete, out of time, brother.
Wow, that it went by so fast. Yeah,
Yeah, it would certainly did, and yeah, it's been fantastic. So, but that being said, Dr. Pete, if people were looking for a naturopathic doctor, they want to get some advice, and they want to basically see you, where can they find you on the World Wide Web?
yeah. So my website is awakenedheart.ca. Okay, my Instagram is Dr. Pete ND. Okay, so it's DRPETEND. And Facebook, Awakened Heart Naturopathic is my business page.
Perfect. And I'll have all that information in the description below. So if you want to reach out to Dr. Pete, please do. He's an awesome guy, awesome doctor too, as well. And that being said, I'm just going to close off the podcast. This has been the Metaphysical Mentor podcast with Michael Philpott. Thank you so much for joining me, and goodbye for now.